Committee meeting for August 4th, 2025. Counselor Smith.
Here.
Waltney.
Here.
Holloman's out. Brandt. Here. And Harden's out. So
All
you
right,
got
we have
got a
three.
quorum.
Holding on to a quorum. Can I get a motion to dispense with the reading and approve the minutes as presented?
So moved.
All right, motion from Mr. Waltney.
Second.
Second from Mr. Brandt. All in favor, please say aye.
Aye.
3-0, those are approved. All right, I'm gonna just real quickly skip through the old business, agenda. Kale, I'm assuming 02/02/25 request permission to provide an update on the Kenilworth Stormwater project, which I noticed our fence is now up. Can we go ahead and drop this? Are there gonna be any further items to address?
There shouldn't be any further items.
Okay, I would entertain a motion to drop 02/02/25.
Motion to drop.
All right, motion for Mr. Waltney. Second from Mr.
Second,
Brandt.
sorry, yes.
Second from Mr. Brandt. All in favor, please say aye.
Aye.
Aye, 3-0, that is dropped. Okay. 14/05/25, request for consideration for AlDOT lighting on Lakeshore and I-65, coming to us from our city manager, Mr. Adams. We have decided to refer this into the budget hearings, because it's a pretty big number. And Mr. Harden is here. So, I don't know if we need a motion to send it to budget, or I'm just, without objection, I'm gonna refer that, 14/05/25 to budget hearings.
Okay.
If you would please.
Yes, ma'am.
Thank you. All right. 03/07/25, a bid date set for August 19th, 2025 for the Green Springs Phase 2 project that coming to us from Cale Smith. I'll carry this over to the bid opening, which is going to be on August the 19th. All right, that brings us to our new business agenda, and I'm going to take a couple of things out of order because we have some folks here for those. The first is 21/07/25, a request to discuss opioid settlement funds and possible allocation within the city, coming to us from our president and Counselor Sims. And Counselor Sims, you want to introduce our guest?
Yes, thank you. So just as a little bit of background, the city of Homewood has been receiving these settlement funds and they've been put in a separate account over the past few years. They're tied to a lot of restrictions from, the settlement, and so there's criteria related to those and how they can be spent. Also, the Attorney General and the League of Municipalities have issued guidance on how to spend those. In the past year, we've had discussions with the Jefferson County Department of Mental Health and also the Alabama Department of Mental Health about programming these funds and best practices, and that kind of just gets us to the point where I wanted to invite John Bales with the Recovery Resource Center to provide some of the work that they do, but also that he's been involved with on the statewide opioid and addiction prevention task force, and also some of the work that he's doing in partnership with Dr. Hicks and JCDH on identifying best practices for Jefferson County in particular. So John has some information he's going to present, but then there's also in the handouts there's a little bit of an overview of a one-pager on the Recovery Resource Center, as well as a draft of the suggested best practices from JCDH and Dr. Hicks. So with that, John, I'll let you introduce yourself. Please give your name and address, and then you can get started with the presentation.
So you can.
All right. Hey everyone, I'm John Bales. My address is 1581 Parkside Court, Homewood, 35209. So Nick, thank you so much, and thanks everyone for just giving me a little bit of your time. I'm the program director at the Recovery Resource Center. Am I going to do this?
Okay.
Okay. So you can just click on through. So a little bit about us. We're a program of the Crisis Center. The Crisis Center is a larger nonprofit that's been around Birmingham for a long time. We're one of their programs. We started in 2018 as a direct response to the opioid epidemic. These are our basic services. So what we do is we offer information. We're basically a central point of information for anyone who's struggling with substance use disorder, anyone who has questions about addiction, recovery. And then we offer primarily assessment services. So for people that don't understand or know what an assessment is, essentially there's two systems, right? You either have health insurance, and if you have health insurance, you can navigate that system relatively easy. If you don't have health insurance, then you're forced to sort of depend on the Alabama Department of Mental Health and their treatment system. Nothing starts without that assessment. The assessment's based on the ASAM criteria, which is the American Society of Addiction Medicine. You have to have that to start treatment and to identify the appropriate level of care as well. Before us, those assessments cost about $30. It would take about 2 weeks to schedule. Anyone who knows anything about somebody who's using IV heroin, they're not just going to stop using and wait for that assessment. They're going to use every day they use is a day they could overdose, a day they could die. So we wanted to just increase access, lower the barriers. We offer the assessments no cost, walk in, same day, no appointment. And then after COVID, we pivoted and we also offer telehealth assessments now as well. Referral's really a fancy word for case management. Basically, it's not as simple as, oh, I found a place, I want to go and get help. Every place has their criteria. Every place has certain barriers. We help people navigate those. And then some places, there's just a really long waiting list, and that period of waiting is when a lot of bad things can happen. Does that make sense? All right. So you can click through. Like I said, assessment is key, but peers lead the way, right? So peers, what that means is it's someone who's in recovery, someone who can relate to that person and sort of say, hey, look, I get it. I know you're scared. I know you're angry. I know you spent last night in Homewood City Jail. I know, and I understand because I did all of that myself, right? I'm a person in long-term recovery. What that means to me is I haven't had the need to have a drink or a drug since April 5th, 2015. But it also means I have purpose today. Primarily, I cannot wait for Thursday. I've got a 5-year-old. He starts kindergarten. I've never wanted summer to end so badly in my life. But I want to be a good dad. I want to be a good husband, and I want to help people avoid the same sort of pain that I went through myself. So that document you have that says draft on it, essentially you can ignore the draft. It is formalized now. Dr. David Hicks, who's the health officer with Jefferson County Department of Health, he got together with myself and a doctor named Dr. Leah Leish. She works at UAB over at a clinic they have on Beacon Parkway. We both serve as chairs on the Governor's Opioid and Addiction Council. I'm the chair of the Treatment and Recovery Committee. That council was established in 2018 to really say, hey, look, all of these funds are going to be coming in. Like the state knew they were going to be getting a lot of funds. The municipalities are getting their funds. County health departments are getting theirs. And it's been the council's work to sort of identify priority areas and best practices. So what Dr. Hicks wanted to do was get together, talk about Jefferson County, what it's looking like in Jefferson County right now, and sort of come up with a dedicated sort of roadmap for municipalities who want to utilize these funds appropriately and consciously. And so that's what you're looking at. The conversations I've had with Nick, and as well, I was here last week, and with Chief of Police, Chief of Fire, Parks and Recs, JJ, Glenn. It was a really good meeting. I was super, super encouraged because what Homewood is doing right now is due diligence. And that's important. These funds are important. The last thing we want is for someone to ask the question that we all asked after Big Tobacco, right? Which is, where did those funds go? So what we want to do here, what we discussed essentially, is offering some assessment services and some training and education. So these are a couple bullet points from the draft document that you have, or the formal document now. These are considered best practices. They're evidence-based, and they're suggested uses. You can click on them. Okay, so for assessments, we could offer the assessment, linkage and referral to treatment, and recovery support for any justice-involved clients or clients at risk of justice involvement. Oh, that's fine. The services would support continuity of care and increase access to the continuum of behavioral health services, not just substance use disorder treatment, but a big issue right now is co-occurring, right? Which also means mental health and substance use going on at the same time. We could utilize all of the RRC services, and essentially they reduce risk of relapse, as we like to say. I don't like saying relapse because We're talking about a medical disease, so we can talk about it the same way we talk about cancer. There can be a recurrence, but our services reduce that risk, and also, of course, reduce risk of overdoses and death by suicide, and for justice-involved clients, recidivism. Here's a sample scope of work. Again, I'm going to say something like, by no means am I sitting up here necessarily advocating, hey, give these opioid settlement funds to one particular agency. That is not what Dr. Hicks wanted to do. That is not what Dr. Leish wanted to do. There are a lot of great organizations here in Homewood doing this work, but there is something to be said about data and best practices and research base. And so we want to draw attention to those sort of partners and those programs. That is the RRC, that is UAB, that is Addiction Prevention Coalition, Safe and Healthy Homewood, wonderful organization. There's a lot of people doing really, really good work. But we would conduct the assessment and then obviously the linkage and referral after that. You can click through. And yeah, that last bullet was just talking about all the different stakeholders that we would work with, including attorneys, probation, parole departments, judges, and any of the other community-based organizations I mentioned. Okay, next slide. So for education, outreach, and training services, a big part of this epidemic has been the fact that we don't know what we don't know, right? So there's a huge education component, education on the resources that are available, and education to reduce stigma when it comes to substance use disorder. There's a lot of training around trauma-informed care, a lot of training around recovery messaging, a lot of training around system navigation. We get very confused sometimes or frustrated when, oh, but we laid out the red carpet. We told this person exactly what to do, but then they're back here again. It's because the system isn't that easy. It's not that easy just to walk in a door somewhere or get help. You can click through. So we could collaborate. We just received another grant to do some work in another county a little north of here. And part of that was collaboration based. So there are community partners that we're going to be working with, and we're all going to be providing different trainings in different spaces. But I mentioned some of the ones we could work with here in Homewood. And I've talked to all of them except Carissa at Safe and Healthy Homewood. But she does wonderful work. She's been a member of the Jefferson County Overdose Task Force ever since it's been in existence. And I think she's probably the only school social worker or school on that task force. So that says a lot about Homewood. This could be the scope of work for the education, outreach, and training services. We would offer the education and trainings, and another grant, again, that we've worked on recently, it was based on a certain number over a 12-month period. And these are some of the topics. You can click through. So I hesitated to kind of put this in here, but I know this is the Finance Committee, and this is what you're talking about. So if we were going to talk about funding, for the assessment and recovery support, there could be a fee-for-service structure. These numbers are based on the Alabama Department of Mental Health and Medicaid billing rates, just so you know. We have a couple contracts with Viva Health and Blue Cross Blue Shield for some work they do around quality improvement for Medicaid recipients, and this is the way the referral and the assessment structures is structured in those contracts. For the training and education contract, this could be a little different. We could do it based on a set number of trainings, like I mentioned, and then also deliverables, where we would have certain components, including outreach, the resource and education events, evaluation. We could assist with any data collection and evaluation activities, and oversight. If there were to be a working group, then we would obviously have someone appointed to that working group and work hand in hand. I think that's it. One more maybe? Okay, yeah. Little story about that. We're over in the new Cooper Green. We used to be in the old Cooper Green. Space was at a premium. We had intake rooms, but we also had to use our conference room sometimes to do intakes with patients. One day we were doing an intake and we had to leave the client alone and go get an assessor and do some kind of case management work. When we came back and got the client and took them in for the assessment, we noticed they had written that on the whiteboard. So it just says, thank you for loving us even when we don't love ourselves. I would not have gotten help without you. So, yeah. Any questions? I sped through that because I know y'all have a packed agenda. And
No, we appreciate you going through that with us. Does anybody have any questions? And what I would assume we're doing here is, because this is kind of our initial hearing of this, that we would carry this item over. I don't know what your thought was, but carry this over so that we can continue to discuss it and figure out kind of what that might look like and what fee structure we might want to see about using.
Yes, I mean, I think that seems appropriate, given that, this is the initial presentation for a lot of the committee members and council. I will say that in, the meetings we've had with police and fire and even public works, there's definitely a willingness to have staff participate in the training and education. So that's already in the works, is knowing, something that's desirable. As far as the assessments, again, those would be something where we could, whether it's fee for service without a set limit, or maybe we, assign a certain dollar amount to this project and programming. But basically, we could work with police to where if there's someone, in the jail, that this assessment becomes voluntary, but something they could receive pre-release, so that hopefully we reduce recidivism. They're connected to services at release, and so that's kind of a lot of the discussion. One of the other things that we talked about as we move forward in getting partners together, and maybe this would be a phase 2 of this, is some of the mobile support that could be provided to people who are not currently at the jail, but actually just having supports cross with, I think you said there's a model through UAB with Cahaba Medical Care, with UAB, with One Roof, to actually provide support services to individuals who are currently unhoused or who just need help within our community otherwise.
Yeah, okay. Walter, did you want to
I was going to say,
something?
this would be a good topic just to send to budget hearings for us to incorporate
see about
this
that. Okay.
into the new budget.
And
That might be.
John, I would think we'd want something from you, if we do training for our staff. What does that look like financially?
Okay.
Because I saw what you do if you're dealing with an individual who's got an addiction, but what does it look like to train our staff?
Sure, I can definitely put something together. What I can say is we've had a similar contract with UAB, and the way that sort of looked like is it was, here's a set amount of money for 12 months, and we were contracted to provide the certain number of trainings, and we just submitted a monthly invoice. But they were monitored, of course. So that is one way, but we could also look at breaking down per training. But then we would have to think about the number of participants and all of that. So
Could you send a copy of that contract that you mentioned with UAB to Nick? And then you can forward it to the rest
Absolutely.
of us. And then maybe a suggestion for whatever that other structure might look like if we were to do a per training kind of a situation. Just so we kind of have both sides of the fence, and we can talk about that when we're in budget hearings.
And I'm sorry, there was one other part of Thursday's meeting too that I wanted to recap. One was that, there are some other expenses which you could use these funds for, which police and fire are currently getting from other resources like JCDH in the state. So like Narcan, like we're not currently having to purchase that because
Right.
we're getting it from other places.
Yeah.
And also when we looked at kind of using these funds to support our own staff through like overtime pay and so forth in fire, that actually Chief Broad had to run some numbers on that and found it more advantageous to outsource that through contracts versus internally. Again, as President Jones referenced, having that discussion related to the budget makes the most sense, but just wanted to provide some additional information on that discussion.
Okay, that sounds great. Okay, well, if you'll get that information to Nick,
Sure.
he can share it with us when we have our budget hearings here in the next month. And what I will do is I'm gonna do the same thing I did before, which is without objection, refer 210725 to inclusion in our budget hearings.
Yes, ma'am.
All right.
all right, thanks
Thank
everyone.
you so much, John. We
Thanks.
appreciate you. Okay, now, I'm gonna take 200725, which is a request for the city manager to sign a lease for third floor office space with Navigate Wealth Management, coming to us from JJ Bischoff and Johan Gross from Navigate Wealth, who are here. Would y'all like to speak to anything, or do you want me to just let Glenn and JJ kind of handle that? I've got the lease right here. This is the portion of space on the third floor that was being leased to Alabama Power. It is approximately 3,720 square feet of space on the third floor. And the initial rent term would be $6,200 a month, or $74,400 a year. Yeah, for 5 years. And then, then the prices go up slightly after that for a 3-year renewal.
Yes.
And if I remember the tenant build out, they're performing their own tenant build out.
Yeah.
Does that cost
Is there
us
anything else, y'all?
That's the only thing I was gonna add.
Okay, yeah, that y'all are doing your build out. Okay.
Right.
So that is, we just need to approve Mr. Adams signing that lease with Navigate Wealth.
I make a motion for approval.
All right, motion to approve from Mr. Gwaltney,
Second.
second from Mr. Brandt. All in favor, please say aye.
Abstain.
Okay, that's 3 to 0 to 1, with one abstention being from Mr. Harden. And with that, that goes out to our full council meeting on Monday night at 6 o'clock next week. All right, thank y'all. All right, now I'll skip back up to the top of the new business agenda, which is 180725, a request for permission for the city manager to execute an LDOT traffic signal lighting maintenance agreement for our DDI project, coming to us from Mr. Smith.
Yeah, so we're gonna, in the next finance committee meeting, we're gonna talk about the diverging diamond bid and kind of where we are on that. So I think it would be appropriate for us just to carry this over until then.
Okay, all right.
Because this has to do with all the new signals and maintenance associated with the diverging diamond. I would hate to execute an agreement
Before we know.
before we know.
Yeah, all right, so that 180725 is gonna be carried over. 190725, a request from Mr. Smith to amend the budget for line item transfers. This is a request to move $1,000 from supplies to travel and conference in order to get an early bird rate for some October conferences, correct?
Perfect.
For your staff?
Yep.
Yeah. So that's a $1,000 move from supplies to travels and conference so they can get registered.
So moved.
All right?
Second. Sorry.
That's okay. Motion from Mr. Gwaltney, second from Mr. Harden. All in favor, please say aye.
Aye.
Aye, 4 to 0, that is approved. All right, skipping down to 220725, request to authorize the city manager to sign a proposal from Eaton Corporation for the installation of new batteries for the UPS supporting the city's core server room, coming to us from our IT director, Mr. Sims. What you got for us, Brandon?
Good evening, everybody. So this is pretty straightforward. In one of the previous meetings, we all approved the maintenance contract that allowed Eaton to come take a look at the UPS unit. They checked the unit seems fine, but the batteries do need to be replaced, so they drew up a scope of work to just get all that done. They'll come in, put it in maintenance mode. There shouldn't be any downtime. And so we're just looking for approval for us to be able to sign this.
And this is a budget amount for $4,050.
Correct.
How long do you think, Brandon, these batteries will last?
They recommend replacing them every 5 years.
How, you know how old, I know you haven't been here that long, but how old these batteries are?
The ones that are in there now, they
Older
need-
than
they-
5.
They need to be replaced.
Older than 5. All right, so we just need a motion to sign the proposal, have Mr. Adams sign the
I'll
proposal.
make the motion to approve Mr. Sims' request. for
All right.
batteries.
Motion from Mr. Brandt, second from Mr. Gwaltney. All in favor, please say aye.
Aye.
4 to 0, that is approved. 230725, request authorization for the city manager to sign a contract for design services for our library renovation phase 4, coming to us from Mr. Smith, and Michelle's here in Judith's stead. So you
Yeah.
want to tell us what
So
we got?
we haven't practiced this, but so we need to start they need to start design of the project for the phase 4 renovations. If you remember, we just did the phase 3 renovations.
Right.
In order to hit the construction ending by May 2026.
To make time for summer reading to start.
Exactly, yes.
Yes, okay. Because the phase 4 is specifically going to be focused in the children's area, correct? Or a majority of it?
And also our public restrooms, 3 of them will be renovated at that time and be making
deeply impact our summer reading.
Yeah,
And some administration wing.
And
bathrooms
some of the
too.
admin.
Yeah.
okay, yeah.
So, yeah, so the total estimate that you guys will see for construction in the budget hearings is about $380,000.
Yeah.
And so the contract is for $36,250.
Okay,
And there's a budget amendment to move money from a bond account to another bond account, a new account set up for library phase 4.
Who's doing what?
Davis is the architect.
all right, so, need a motion for Mr. Adams to sign the contract for design services for library renovation phase 4.
I'll make the motion to approve.
All right, motion from Mr. Brandt,
Second.
second from Mr. Harden. All in favor, please say aye.
Aye.
4-0, that is approved. And with that, finance is adjourned.